Imagine your world slowly fading to black. For some people, this is a devastating reality. Their eyes, the very windows to their soul, become damaged beyond repair. This often happens because of a part of the eye called the cornea. The cornea is the clear, protective outer layer, like the crystal on a watch. When it gets severely scarred from burns, diseases, or terrible accidents, light can no longer pass through it. The result is complete blindness. It is a profound loss that changes every single aspect of a person's life, turning familiar surroundings into a maze of darkness and uncertainty. For these specific cases of extreme corneal damage, many common treatments simply do not work. Doctors might try a standard corneal transplant using a healthy cornea from a donor, but when the eye is too damaged, the body often rejects the new tissue. The eye's surface may be too dry or have too much scar tissue for a donor cornea to survive. Artificial corneas made of plastic also face similar rejection issues. The body's own immune system sees these solutions as foreign invaders and launches an attack, leading to failure after failure and leaving patients feeling utterly hopeless. This is where medical science takes a truly astonishing turn. It sounds like something out of a science fiction novel, but it is very real. Surgeons in Canada have pioneered a revolutionary procedure that uses one of the patient's own body parts to restore sight, a tooth. This incredible surgery is called Modified Osteo-Odonto-Keratoprosthesis, or MOOC-P for short. By using the patient's own tooth, doctors have found a way to trick the body. The body recognizes the tooth as its own, so it doesn't reject it. This allows a new, clear window to be securely anchored in the eye, finally letting light back in. This tooth and eye surgery represents a monumental leap forward in ophthalmology. It is a creative and brilliant solution to a problem that once seemed insurmountable. The idea of using a tooth to fix an eye shows how interconnected the human body truly is. It's a testament to the relentless spirit of medical innovation and the search for answers, even when the path seems impossible. For those who have lived in darkness for years, this procedure isn't just a surgery. It's the dawning of a new day, offering a chance to see the world and their loved ones once again. The journey to restore sight with a tooth is a careful multi-step process that is nothing short of medical artistry. It requires a unique collaboration between different medical specialists. The process begins not in the operating room of an eye surgeon, but in a dentist's chair. A dental surgeon carefully extracts one of the patient's own teeth, usually a canine tooth because its shape and size are ideal for this purpose. The tooth, along with a small piece of the surrounding jawbone, is then meticulously prepared for its new and extraordinary role. This is a critical first step, as the health of the tooth is paramount to the success of the entire procedure. Once the tooth is removed, the surgical team gets to work shaping it. They trim and flatten a section of the tooth and drill a tiny, precise hole right through its center. Into this hole they fit a custom-made optical cylinder, a small plastic lens. This lens will become the patient's new pupil, the clear gateway for light to enter the eye and reach the retina. The tooth now acts as a natural biological frame holding this artificial lens. It is a perfect marriage of organic material and man-made technology, creating a living implant that the body is unlikely to reject. The prepared tooth and lens combination is not immediately placed in the eye. It first needs to develop its own blood supply to ensure it will survive in its new location. To achieve this, the surgeon implants the entire structure under the skin, often in the patient's cheek or shoulder. For the next 2 to 4 months, the tooth lens device lies dormant, allowing the body to grow new tissue and blood vessels around it. This incubation period is vital. It transforms the tooth from a simple extracted object into a living piece of tissue, fully integrated and ready for the final, delicate step of the procedure. Finally, the moment of truth arrives. The eye surgeon carefully removes the now vascularized tooth lens implant from its temporary home under the skin. They then prepare the damaged eye, clearing away the scarred cornea and other tissues that are blocking vision. The living implant is then meticulously stitched into place in the center of the eye. The piece of jawbone attached to the tooth helps to anchor it securely. Once in position, the plastic lens inside the tooth provides a brand new clear pathway for light, allowing the patient to see through their own tooth. To understand the life-changing power of this surgery, we can look at the incredible story of Brent Chapman. Brent was a man who lost his sight in a truly tragic way. He had a severe reaction to medication, a rare condition called Stevens-Johnson syndrome. This condition caused his corneas to be completely destroyed, plunging him into total darkness. For years he lived without sight, unable to see the faces of his family or the world around him. He tried various treatments, but nothing worked. His situation seemed permanent, a life sentence of blindness. He was left with little more than the hope for a miracle. That miracle came in the form of tooth and eye surgery. Brent became a candidate for this groundbreaking procedure. His medical team, a dedicated group of dentists and eye surgeons, worked together to give him a chance to see again. They removed one of his teeth, fitted it with a lens, and began the long and patient process. For Brent, this was more than just another medical attempt. It was a ray of light in his dark world. The idea was strange, almost unbelievable, but it was his last and best hope for regaining the precious gift he had lost so suddenly. The surgery was a stunning success. When the bandages came off, Brent Chapman could see. After years of living in a world of blackness, light flooded back into his life. He could see the details of the room, the colors, and most importantly, the faces of his wife and children. It was an overwhelmingly emotional moment, a true rebirth. His story became a powerful testament to the procedure's potential. It showcased how this unconventional surgery could succeed where all other methods had failed, offering a tangible solution to those who had been told their blindness was incurable. Brent Chapman's experience highlights the unique strength of this operation. Unlike a standard corneal transplant from a donor, which his body would have rejected, using his own tooth provided a perfectly compatible foundation for the new lens. His body accepted the implant because it was made of his own tissue. This is the key reason why tooth and eye surgery works for the most severe cases of corneal blindness. It bypasses the body's immune response, which is the biggest hurdle in eye transplantation. Brent's story is not just a medical success. It is an inspiring tale of resilience, innovation, and the profound joy of seeing again. When we compare tooth and eye surgery to other treatments, its unique brilliance becomes even clearer. Standard corneal transplants rely on donor tissue, which carries a high risk of rejection, especially in severely damaged eyes. The body's immune system is designed to attack anything it doesn't recognize. Artificial corneas, known as keratoprostheses, can also be pushed out by the body or become infected. The MUC-P procedure, however, is fundamentally different. By using the patient's own tooth and bone, it creates a living, biological structure that the body recognizes and accepts. It's like using an original part to fix a machine, ensuring a perfect, lasting fit. This remarkable surgery is a shining example of interdisciplinary teamwork in medicine. It simply could not happen without the combined expertise of both dentists and ophthalmologists. The dental surgeon is responsible for the delicate extraction and preparation of the tooth, ensuring its viability. The eye surgeon then performs the intricate work of implanting this biological lens holder into the eye. This collaboration bridges two distinct fields of medicine, uniting them for a common purpose: to restore sight against all odds. It shows that the future of medicine lies in breaking down silos and combining knowledge to solve complex human problems. The impact of this surgery extends far beyond the operating room. For patients who have spent years or even decades in darkness, it is the answer to a prayer. It gives them back their independence, their ability to navigate the world, and the simple joy of seeing a sunrise or a loved one's smile. The psychological and emotional healing that comes with restored vision is immeasurable. It is a second chance at life, a return from a world of isolation. This procedure doesn't just fix an eye, it rebuilds a life from the ground up, piece by precious piece. Ultimately, the tooth and eye surgery stands as a profound symbol of hope. It tells us that even when a problem seems unsolvable, human ingenuity and perseverance can find a way. It offers a real possibility of sight for a small but significant group of patients who were once considered permanently blind. For every person like Brent Chapman who can see again, a powerful message is sent to others living in darkness. Do not give up. Medical science is constantly advancing, pushing boundaries, and turning what was once impossible into a new reality. A new dawn is truly breaking for those who thought they would never see the light again.